Hello, my name is Dr. Samina Wahhab. I'm a board-certified plastic surgeon. I started my practice 13 years ago. This is my sister Ruby. She's a hot mess.
Hi, I'm Rubi Nicholas. I'm a stand-up comedian, and my sister's a plastic surgeon who I'm trying to con into giving me a free butt lift. Right here. This is where it's going to be. You're my sister, and you're a plastic surgeon, and I totally need you to help me because you know that it's not my fault that I have bad self-esteem. Because Dad made me have bad self-esteem. Because, do you remember what my graduation from college gift was from you? Do you remember what it was?
From college?
Yeah, when I graduated from college.
I remember what it was.
Do you remember what it was? Of course she remembers what it was.
I remember the second
My graduation gift was liposuction and a hip reduction.
Yeah.
So remember? It was such a good gift. So the gift was a proportioned body and low self-esteem.
Mom,
so I thank you for that. Ruby, I know. Well, it's not my fault. So I think it's totally appropriate as my big sister.
Do you really want it to be about your self-esteem though?
Well, I mean, it's part of it, right? Normal people don't just like get their butt hacked open and pulled up by their sister.
I do it every day.
You do it, and it's not because they have bad self-esteem.
Yeah.
Why do they do it?
Because
why do people get surgery?
Mom,
So now your daughter, whose gift was what? You didn't be a plastic surgeon. Mm-hmm. You were a surgeon.
Just stop it.
And now she's a plastic surgeon.
I know.
So our legacy is now my low self-esteem about my body, and your other daughter, who completed your fate by becoming a plastic surgeon, which is amazing. So together, your legacy is one daughter giving the other daughter a much-needed butt lift right here. It's such a good idea! Aren't you excited? Clap, because it's exciting. I know.
Most of the time, it's just so that they can look normal and feel normal in their bodies. A lot of times, especially for a butt lift, it's after massive weight loss, so there's extra loose saggy
I lost
skin.
massive weight. I lost 47 pounds and I have
know.
saggy skin. I keep showing everybody. Is that lame? Is it weird?
No, it's fine.
I heard, like, one time in a lecture a long time ago, they said inappropriate self-disclosure is the hallmark of low self-esteem. I totally have that. I inappropriately show my butt fat to everybody.
It could also be some kind of sign of like an egomaniacal kind
Well, it's
of
like attention-seeking. I think all comedians have that to some degree, like an attention-seeking
just
situation.
a narcissist. You think everyone wants to look at your ass.
Well, but not in a good way. I want it to look better. If people are going to look at it anyway, which I'm sure is the case, if people are going to look at it anyway, I want it to be awesome. And if you can make it awesome, do you think you can?
Yes.
You did a really good job with my belly button.
Thank you.
Everyone's super impressed by that.
Thank you.
So people ask me, they're like, your sister's going to do your butt lift. I'm like, yeah. And they're like, you really are okay with that? And I'm like, yeah. Because remember when Dad took Mom's gallbladder out?
I know, it was a mess. Well, it was very good until the little complication.
Well, it was weird because she had a complication and she was back in the hospital and everybody was like, what the hell? Why did you do that to your wife? And he's like, it wasn't on purpose. And like, it was nuts. But she was fine. So, I mean, someone said, like, what's the worst that could happen? And I'm like, well, I could die. Like, that's the worst that could happen, right? Like, we don't want that outcome, but that's the worst. You must have two opinions, right? Yeah. You must have an opinion as a doctor. Mm-hmm. What's your opinion as a doctor about getting a butt lift? Do you think it's just like, yeah, whatever, do what you gotta do, be happy in the world? That's exactly your opinion? Mm-hmm. What's your opinion as a dad?
You're crazy.
I'm crazy. All right. Well, I mean, that makes sense, though. Because I need to understand that because I think it's different. Okay, and what's your opinion as a doctor? You're a doctor, a plastic surgeon. Mm-hmm. Do you think this is necessary?
Nothing cosmetic is ever necessary.
Nothing cosmetic is necessary, but look at it. I hate it so much.
Well, if you hate it and it will make you feel better, then we can do something to fix it, but it's not necessary. Oh. Food and water is necessary.
You guys are the worst.
It's not necessary.
But do you agree though that it's pretty much Dad's fault that I care this much about this much fat?
Yeah, it's all my fault.
It is.
Yeah.
It can be very cathartic for me to have her take this out because she was your favorite anyway. So.
No, she's my favorite.
No. That happened to like one of the Desperate Housewives or Real Housewives or something. I don't know. I don't watch TV. So one of the people got a thing, and then some lady at work was like, dude, don't get a butt lift because your butt's going to fall down and all your skin's going to die because it happened on TV. And I was like, did that lady smoke? Because I remember that was like a big deal. Last time you yelled at me, you were like, if I need to pull the nicotine level out of your blood, I'll do it. Which I didn't even know that was possible, but I'm like, all right, whatever. So I have to quit smoking.
What
if I don't quit smoking? Can I secretly not quit smoking?
If you secretly don't quit smoking, that is where your really bad complication can occur, which brings us back to what is the worst complication than death. So death is off the table for you at the moment.
Knock on wood.
But the other complication is wound healing problems and wound necrosis. You have a very long incision.
You're so sciencey and stupid.
And
what's necrosis? What does that mean? Smoking before my surgery. How many weeks before surgery?
Minimum of 6 weeks.
Minimum of 6. And we're going to do it at the end of October. So end of September. End of August.
Let's just go with Labor Day. No smoking after Labor Day.
Labor Day is in September. Oh, I can smoke all over. Really, really bad. I'm going to quit, but you know what? Can I just tell you, as my doctor / sister, I just had my annual well visit. My blood pressure was 98/54, and my resting heart rate 65.
Yeah, and that's great.
And my BMI is 25.
And all that's good.
I'm in good shape.
You're in good shape, but it still does other
But I do
things
wake up
to your
coughing at like
So
5
does
o'clock in the
that.
morning.
Right.
Yeah, I think I'm going to go out with emphysema. I'm going to go that way. The main thing...
Or COPD.
COPD, yeah. Atelectasis. That's what that is.
No, that's different.
I heard that word once. I dated a respiratory therapist once. He said that word. I thought it was cool sounding. No. So what do you think? Do you think I should do it?
Go ahead.
I think I should do it. I think I
If
should
you're
do it.
happy, that's all it is.
Right, that's all it is. And that's what being a good dad's all about.
Thank you.
Thanks, Dad.
On the next episode, watch the Plastic Sisters play with Botox.